The name of our project is Analysis of the Detriments of Climate Change on Brazilian Public Health. That being said, we focus on how Brazil is being impacted by climate change, specifically the effects on health. We're first going to talk about the concepts that we have learned from the course, which have been applicable to our research. We're then going to expand on that idea and discuss it in a different context, the context being the effects on Brazil specifically. We do this by providing background information and statistical data. We will further explain its relevance by providing examples which demonstrate just how severe climate change has impacted this country's health. Even though environmental pollution is trying to be controlled, it has drastically changed throughout the years, and the effects have impacted more than just the environment. More people have become susceptible to disabilities and illnesses caused by climate change because of the increase in environmental pollution. We are going to be looking at Brazil and how environmental pollution created climate change. In addition, we are going to examine how climate change is affecting the health of the individuals of Brazil over time. Brazil is vulnerable to climate change due to the large amount of rainforest that occupies much of the country. To get an image of how vast the rainforest here is, it accounts for about 40% of Earth's total rainforest biome. Climate change has also been found to increase the risk of infections. This is because there has been a correlation found between infectious disease outbreaks and climate change. This second point is closely related to the third point, which is an increase in temperature. Higher temperatures are more favorable conditions for certain vector-borne, waterborne, and many other infectious diseases. For example, mosquitoes are a major carrier for a disease known as malaria. Since Brazil's climate is slowly turning into a favorable home for mosquitoes, the mosquito population is increasing. An increase in the mosquito population means a greater possibility for malaria transmission. This leads to a wider and faster spread of this disease. The last factor that we considered is forest fires, which is a major contributor to environmental pollution. There are a few different things we need to consider when talking about the fires. Firstly, it is the amount of greenhouse gases that are being released into the atmosphere. Those gases are being released not only harm the environment, but the citizens who are also inhaling it. Pollutants can cause serious health issues like cancer, DNA damage, and respiratory diseases. They are also accountable for pathogen spillover and habitat loss. It then leads to human and animal migration, causing urbanization of green areas and, again, the spread of vectors. In this graph, we can see the patterns of fires between the months of January and November. When summer is a more dry season, it is no surprise that the spike in the graph begins to rise once summer begins. Another thing worth mentioning in this graph are the depictions of different years. Darker lines are the most recent years, and it is worth mentioning that they show an increase in the frequency of fire detection in recent years. This could be due to the worsening conditions of the drought because of the worsening conditions of climate change. The drought in Brazil has been closely linked to climate change. This is due to the prolonged dry conditions that have been mostly seen in central and southern Brazil. It is because of this drought that the rate of fires in the rainforest has increased. Since the rainforest is more dry, the trees are more prone to fires. This again correlates and adds to a longer list of the dangers of fires that were mentioned before. There is also an increase in illnesses, not the ones previously discussed, but things like malnutrition and mental health. There has been a study that proves that extreme weather events can affect chronic health, which can have effects on mental health. One interesting impact of this drought is a decrease in sanitation. This is because many citizens are migrating to different areas of Brazil, with the majority of them feeling drier conditions and moving to overcrowded areas. This overcrowdedness leads to a decrease in the sanitation of these areas. Even though this is not a direct result of the drought, it is still an indirect effect of climate change. As much of the land is being burned, there is also a decrease in agricultural land and availability of crops. The drought has affected the water availability and agriculture, which leads to food insecurity and shortage, which can impact public health.
So the group that is impacted the most are logically people who rely on natural resources. This includes farmers, indigenous populations, and homeless people. A lot of the time, their primary source of income comes from natural resources. This ends up driving a lot of people out of the region as their lives are no longer sustainable with the present resources. Looking at a specific case, Northeast Brazil has suffered consistent periods of drought as a result of climate change. In a 2014 study published in the International Journal of Environmental Research and Public Health, census data was taken from 1991, 2000, and 2010. The yellow box plots in this graph describe a region of drought, in this case, Northeast Brazil, and the green plots are the rest of Brazil. The main thing to note in this chart is that the infant mortality rate in the drought region of Brazil is consistently higher than that of non-drought areas of Brazil. We see another indicator of poor public health due to drought with the Municipal Human Development Index, which is an index based on education, income, and life expectancy. Semi-arid regions exhibit lower human development indexes each year compared to the rest of Brazil. We've talked about direct effects of climate change on public health, but there is one particular indirect effect: migration. So the individuals whose resources are stripped from them due to extreme disasters are forced to move into larger cities in hopes of finding new opportunities. This is a relatively common trend in Brazil, especially in the past few decades. In a 2002 study, it was reported that around 2 million to 3 million people moved out of Northeast Brazil to Southeast Brazil due to drought in the Northeast. However, when there is an unexpected surge in migrants into a region, that region is not properly equipped to handle those many individuals. This leads to a thin spread of resources in the region, with a lack of water, fewer doctors, higher infant mortality, and lower life expectancy. Now, a lot of what we've talked about with Brazil parallels what we have discussed in class. Specifically, we looked at how an individual's location has specific disadvantages and the influence of wealth on the response to climate change. Holistically, we examined how all these factors expose cracks in our current healthcare system. When talking about location, geographically, Brazil is home to many rainforests, and it is located close to the equator. This makes it more prone to natural disasters and disease outbreaks. However, climate change has aggravated this. Even within Brazil, the region has impact on the resources available. For example, more rural areas have less access to hospitals and healthcare overall. Being located in the global south, environmental pollution creates inequalities on how readily equipped Brazil is to respond to the drastic impacts of climate change. Wealthier countries contribute a much more significant amount to climate change with gas emissions. However, it's the global south that has to deal with it, with what money they have. And as mentioned before, low-income individuals such as farmers, indigenous people, and homeless people are forced to migrate due to lack of opportunities in the region as a result of climate change. Going back to the 2014 study, it was also found that areas of drought have an overall lower income and lower life expectancy. So, individuals of low socioeconomic status in Brazil are disproportionately affected by climate change, leading to a more drastic decline in their health. We have previously focused on disparities within the US of who has access to healthcare and if it is actually accessible to them in both their socioeconomic status and geographical areas. This includes differences in who can afford and qualify for healthcare and limitations such as transport that prevent people from being physically able to access medical care. We have chosen to focus on a country that has actually achieved universal health coverage, but still faces disparities in who can access medical care due to the heightened effects of climate change. They are likely only able to seek medical attention in urban areas where clinics are most common, limiting their healthcare accessibility despite having the coverage. And the mass migration will continue to overcrowd cities as climate change pushes them out from rural areas. Southeast Brazil is currently suffering from unexpected heavy rainfall and severe flooding that has killed more than 46 people. Let's take a look at its specific effects and what officials have to say.
Catastrophic rainfall slamming southeast Brazil, now killing at least 46 people. Entire roads washed away in the downpours. Donations now rushing into the state of Sao Paulo as hundreds of rescue workers continue searching for survivors. Landslides and flooding followed the huge weekend deluge.
É uma coisa sem explicação, é muito rápido. Ou você corre, ou você morre. E não dá para carregar nada, né? Só a sua vida. Então, que é o principal, né?
Sao Paulo's governor saying in a statement that nearly 800 people are left homeless and at least 1,700 are now displaced. President Luiz Inácio Lula da Silva flying over affected areas with cabinet ministers, pledging to help construct new houses in safer places.
Eu posso garantir que os meus ministros, governador, estarão dispostos a conversar para que a gente compartilhe, para que a gente faça uma parceria para recuperar efetivamente, de verdade, o estrago que a chuva fez aqui em São Sebastião.
Although Brazil's healthcare covers all of its citizens, those displaced or impacted by the floods will have difficulty receiving necessary treatment, as hospitals and clinics are in more crowded urban areas. However, as said in the video, the minister is committed to combating these natural disasters, which leads us into talking about climate hope. In addressing the impacts of climate change on public health, it's also important to discuss courses of action and climate hope. Brazil had its first Indigenous minister in 500 years. Since Indigenous people are one of the main groups whose health is affected by climate change, the minister representing this population is a monumental step towards action. One specific solution in focusing on nature-based solutions. The United Nations Environmental Assembly defines this as steps to protect and sustainably use natural resources to benefit citizens and biodiversity. This addresses issues like food security, human well-being, water security, and disaster risk infection. The country is also raising the share of renewable sources, wind and solar power, in the country's energy mix to 45%. They're also planning on restoring and reforesting 12 million hectares of forests, coupled with stricter regulations and heavier fines when it comes to protecting the Amazon from deforestation. As we zoom in on Brazil, we can see how drastic the effects of climate change can be. Climate change has severely affected the nation's public health, disproportionately impacting individuals based on wealth and location. But climate change is not exclusive to Brazil. Every country is impacted by it, and we should highlight Brazil's experience in order to better develop our understanding of climate change on public health.